for joining me today. I think it'd be really good for you. It'd be really good just for people to hear your story, really, about how you recovered from your back pain that you're getting. I think there'll be a lot of people that will relate to this story, and I think it'd be good to see. It'd be good for people to see where you were to where you are now. So, if you don't mind, if you just don't mind giving a bit of a history about the back pain you're getting, when it started, and what type of treatments you've already had, that sort of thing.
Yeah, no worries. So basically, my back pain started when I was in my second year of university, and that was 16 years ago now.
Right.
And literally, that was from a taekwondo accident. And the initial pain started when I did a taekwondo move, and I couldn't walk for 2 weeks. So I was literally bedridden for, like, say, 2 weeks, and not knowing about, being 18 or whatever, not knowing about all these fantastic things out there. I just laid down and it kind of rectified itself. However, it then came back to haunt me every 2 or 3 years really badly. Okay. So I'd live with the pain, just for a while. And then every 2 or 3 years it'd come back with a vengeance, and then I'd be out for about a week or so. So that's gone on for the last 14 years. And then my wife fell pregnant, and I decided that I'd actually do something about my back, because I didn't want to be one of these dads who just sits around and does stuff. I wanted to be active and stuff. So I started seeing a chiropractor about 18, 19 months ago.
Okay.
And yes, he got things moving. However, it got to a stage where I was just getting constant pains down my leg, and really bad pains down my left leg, numbness in the leg, and things like that. So this all started from April the 1st last year.
Right.
Was it April the 1st last year? No, April the 1st this year, sorry. Where I moved something in the garage, and I felt fine, no back pain. I was quite surprised how well my back was. And then woke up on the Sunday morning, and I literally was in the worst pain I've ever had. Right. So my wife contacted the call-out doctor. He prescribed me with, I think it was some diazepam, some morphine, something else and something else. And he said, try that and we'll go from there. So we tried it. Literally, I was still in excruciating pain, couldn't move. I was just bent over a chair. I literally couldn't sit to go to the toilet. I couldn't do anything. Right. It was really excruciating pain.
Yeah.
And so we rang the doctor back up, and he basically turned around and said, just double everything that we've given you. So we did, and still no pain relief whatsoever. I can't describe the pain. It was just something I never ever want to feel again.
Right.
And we rang back for a third time really, and they said, look, we've given you enough drugs to knock out a small elephant, so you're going to have to go into hospital. Right. So that's when they put me into hospital and had all the tests. And they diagnosed me with a slip disc that was pushing out onto my nerves. It wasn't pushing inwards, it was pushing outwards. So went from there, really. And then this went on for a couple of weeks. I can't really remember when I first saw you. I think it was around May time, was it?
Was that? I think it was a bit later now. I think it was actually July time. Okay.
So about 2 weeks before that, it flared up again, because it was getting better, but then it flared up. I could hardly walk. I couldn't stand for more than a couple of minutes. I was literally housebound. Couldn't lift up my son, couldn't do anything really. Mm. And I rang the doctors for some diazepam to get a bit of relief. And then that's when I spoke to Dr. Thomas down at the doctor's surgery, and she recommended seeing you.
Okay.
And that's kind of where it's gone from, really. So literally, for I'd say the best part of 2 months, I couldn't walk. The pain was excruciating. Couldn't put any weight on my left leg. Yeah, I've dislocated my shoulder before, and to be fair, that was nothing compared to the pain I had in my leg, in my lower leg, in my foot, numbness. No actual pain in my back, but more in my buttocks and downwards, if you know what I mean.
Right. Okay. And I think you said you've been to see a spinal consultant as well.
Yeah, so I'd seen a spinal consultant. I was seeing a chiropractor. I'd seen a sports masseuse, a physio, and the sports masseuse couldn't get to the. She said she did a load of tests, and she said if you had sciatica, you wouldn't be able to do X, Y, and Z. So she goes, you can do that, and it was nobody could actually pinpoint and say it's this. And then I started seeing the spinal consultant. I can't remember the exact dates. However, he had an MRI, and it showed two slip discs really. I think it was L5 or L4. I can't remember. It may have been lower. I'm not sure. But yeah, he said I got a bulge slip disc, and the only real things I had options to me, because I explained that I had been through X, Y, and Z, was an injection or surgery. So we went for the injection.
Yep.
Had the injection, went in, stayed there in hospital for 4 or 5 hours, had the injection into the spine, which was really painful as well.
Right.
Because he kept missing the hole, apparently, and kept tapping my spinal bone, and it was like, oh, this isn't
okay. Okay.
And then had
into it.
the injection, and there was no pain relief whatsoever, really.
Right. Okay.
And yeah, literally from then seeing you was really the only real pain relief I had.
Yeah. So just before you came to see me, I think you were taking quite a lot of medication at the time as well. I think I remember you saying you were almost
so
30 times a day. And
yeah, my daily regime was to get up. I'd take 2 tramadol, 2 paracetamol, an naproxen, 500 milligrams. God, I think that was it for the morning. And then literally I take that I take the tramadol, the paracetamol, 4 times a day. So there's 8 tablets of each. Then I'd take naproxen at night, naproxen in the morning, and then I'd also take 5 amitriptyline at night.
Right. Okay. So
obviously shots of Oromorph every hour or so.
Oromorph when needed. Yeah. Yeah. So
and that would be anything from 5 mil up to 20 mil.
Right. Okay.
Depending on how much pain I was in.
Yeah. So at that stage, you're really pretty dependent on the pain medication.
Oh, yeah.
Yeah. I
knew exactly when my tramadol would wear off, and I knew exactly I had to take it.
Right. Okay. Okay.
Yeah, it was literally, that was my regime for 3 or 4 months.
Yeah. And you'd also stopped. I think you stopped doing a lot of things that you enjoyed doing, like swimming and cycling. And
yeah, I stopped doing swimming, stopped doing cycling. Couldn't really pick up my son. Couldn't drive even. Couldn't even take the dog for a walk.
Right. Okay.
Yeah, it was pretty dark times.
Yeah.
Yeah.
And then it wasn't until you saw a locum GP.
Well, no, I spoke to a locum GP on the phone, and I asked her for some diazepam to get over, because my back, in the words of the doctor, my back flared up again. And the tramadol, the Oromorph, the amitriptyline, the naproxen wasn't working. So the only thing that I'd had previous was a bit of diazepam to get through the week and almost just help get moving again. Right. So I rang the doctor up to say, could you prescribe this to me, because the stuff I'm on isn't working. And she was like, I will, but I don't necessarily believe it.
Right. And
I was just like, well, what do you mean? And she said, well, there's a guy, yourself, Matt, who runs this chronic pain clinic, and they've done a lot of research into things about how it's not necessarily actual back pain that's causing the pain, it's something else. And I've got to be honest with you, when I first spoke to her, I was like, this is a load of... But I said, I was in that much pain that I literally said, you know what, I'll give anything a go. I'm happy to go and see him. And if you recommend him, then yeah, fine.
Okay.
So that's when we had our initial meeting and went from there.
Yeah. So we went through so the SERP approach, the Stress Illness Recovery Program. So trying to get people to think about their pain more psychologically and understand that it's pain can actually be triggered by the brain and central nervous system. Doesn't always have to be anything structurally wrong to cause pain. What would you say was so we're going through that approach. What was it that you found most useful about that?
Well, to be fair, it's just like we talked about. I had a pretty hard, so I say, 18 months with my mum passing away and mum being rushed into hospital and mum having a serious illness that's basically made her rely on us a lot more. And I don't know, it was just really speaking to someone who was neutral, really, because I've always had to be there for everybody else. And like speaking to you, you didn't know me from Adam, say, and it was just kind of like, like I remember in our first meeting, I just burst into tears. I didn't know why, and it was just kind of like, right, perhaps there is some underlying problem that I'm not dealing with on a daily basis, and perhaps it is me trying to mask that pain by something else. I can't really explain it, if I'm totally honest with you. It's just with everything that's been happening over the last 18 months or so, I just think, perhaps it was me trying to mask what was actually happening in real life and giving it almost a physical presence to say, yes, times are a bit shit, but I've got this pain and I'll deal with it, type of thing. I don't know. I can't explain it. It's just from talking to yourselves and you giving me the techniques to deal with these other issues, I suppose, then make me realize, think about my pain in a different way and things like that. With with the example you gave me about the guy with the nail through the shoe, right? And that's really made me think that perhaps there is something to this, So that's when, because even my wife said from after even our first meeting, she said, you look totally different. Right. I was like, wait, what do you mean? She just said, you're walking straighter. All right, I still had a lot of pain, but she said that I was walking straighter, I was moving easier. She said, I just looked different.
Right. Okay. Yeah. And so, so I mean, it sounds like that was the first time really that you'd sort of thought about the pain in that way, as looked at what was going on in life, and that could be a factor in the pain that you were getting. Yeah, because
the problem I always had was everybody said, "Oh, it's this, it's this, it's this, it's this," and then you kind of went, "Well, it could be this." It's like the doctor who I was talking to, Dr. Thomas. She said you could give everybody in this room an MRI. 25% of them would have a normal back, but would have pain. 25% of them would have a slipped disc and no pain. 25% of them would have a slipped disc and be in severe pain. And so it's kind of like there's no set rule as such. And it just made me start to think about perhaps there are underlying problems, not necessarily physical problems, but more mental, if you like.
Okay. So again, you move away from thinking about the pain as purely a structural problem to actually looking at what was going on in life. But then also, I think, you giving yourself the time and space to look at some of those things and actually, make some changes.
Yeah.
Also helped as well.
Yeah, like give me some techniques. Like, I mean, after our first, I didn't really know what I was doing, but all I just kind of try and think about was, I'm not checking in with my back. I'm not, is it all right? No, just trying to say the pain's not a factor anymore. Just get on with me. And whether that just made me looser and made me move more, and then things just started to fall back into place. Because I wasn't thinking that it was such, because I was thinking the pain was something I couldn't do something because of the pain.
Right.
So I wouldn't do swimming, or I wouldn't do walking because the pain was so bad. But it's kind of like, after meeting you and going through the processes that we've gone through, you kind of showed me that just get on with it, just do it, and don't think about the pain as such.
Well, take away the
yeah, I can't explain it, but it was just kind of like, through the things you told me to do, like, all right, the journaling, I didn't really get to grips with the journaling, but I did write some stuff on my phone and then deleted it straight away.
Right.
So I'm trying to deal with these things rather than just let them fester in your head type of thing.
Right. Okay.
And I just kept telling myself, I've got a good back, I've got a strong back. And, I even made up a little song, if I'm honest, just to sing to myself. Just, you got a good back, you got a good back. Just get on with it, get on with it.
Okay, great.
And, that helped me then. Just like, we're in the middle of an extension at the moment. That helped me almost take my mind off the pain and just get on with helping the builders, like just move some stones. All right, I didn't overexert myself, but
yeah,
enabled me to do things that almost probably just loosened everything up, and everything could then start getting back to normal.
Yeah.
Which, all right, I'm not going to say I'm 100%, but I'm 99.9% there.
Okay.
And
so what are you? Yeah. So what are you doing now then? What would you say? Compared to where you were, what are you?
So if I go back to where I was, where I couldn't stand for any time at all, I couldn't walk for more than a couple of meters without being in severe pain, couldn't bend, couldn't pick my son up, couldn't rock my son, couldn't do it. Literally, I was almost couch bound. Literally could not do a thing. Couldn't sit at a table, couldn't sit in a chair. And now I'm walking 3 or 4 miles a day just for back in work. I'm driving better. I'm, started swimming. If anything, I'm lumping blocks around at home.
Right. Yeah.
Just back to normal. I shoveled 30 ton of scalpins, which I would never have dreamed of attempting before. But so I think it's just back to normal. Like you say, we're always going to have a bit of pain, but I think it's more muscle than any back pain as such. I think I'm just at a stage now where I didn't do anything for so long that I'm unfit, and I've just got to get fitter and get my muscles back to, you're actually going to have to do something instead of doing nothing.
Yeah. And how does that feel? How does it feel to be back doing all of those things?
Amazing. Absolutely brilliant.
Yeah.
Yeah, I'm picking up my son, I'm putting him to bed, and it's just, life's how it should be.
Yeah, definitely. Yeah. And if you had maybe one bit of advice that you could give to people, or what would you say? Because I think a lot of people probably relate to this story. I think there's a lot of people out there.
If I had to say anything to everyone, there's going to be these people who are going to tell you, yes, you've got this, you've got that, but like Dr. Thomas and yourself have said, it's not necessarily down to a physical thing. It's easier said than done when you've got back pain, because the back pain is the worst pain I've ever had in my entire life. And it is difficult to do anything, but almost just like try thinking about it as, yes, I've got pain, but I'm dealing with it. It's not something that should stop you. It's something that should give you almost the kick up the backside that you need to go and actually do something. Because it's so easy just to sit there and yes, I've got back pain. I can't do this. I can't do that. But from what I found in my experience, yes, I was in that place. But after meeting with yourself, and you say, you know what, you can still do this. You can still do that. You know, use these techniques that we've given you, and you'll be able to do these. And I'm living proof.
Yeah.
I was in a place where literally my wife had to push me around in a wheelchair in Alton Towers. And, you know, I've got pictures if anyone wants to have them. They find that. I've got pictures of me being in CBeebies land in a wheelchair holding my son because I couldn't walk.
Right.
And now I'm taking the dog for a walk. I'm taking, 2 or 3 mile walks. Yeah, I can't explain it. It's just, it's a hard thing to do. Like, I'm not saying it's easy, but you just got to deal with the pain. Look at these case studies that you give me about, now for the shoe and things like that. And that's what gave me, you know what, actually, perhaps there's something about this.
I got you started thinking differently about it. And
yeah, because I've got to be honest, I'm a pretty simple bloke. Anyone tells me it's all in my head, I'm going to go, But, us men, we aren't the best at admitting that there's something wrong upstairs.
Yeah.
So it's always got to be physical or something like that. And yeah, I'm living proof.
Yeah.
What's all upstairs?
Well, that's great, Adam. So yeah, I mean, thanks for telling your story today. As I said, I think a lot of people will relate to that, and hopefully they'll be, people will be able to see that actually maybe just thinking about their pain a little bit differently, starting to look at other factors and, not just structurally, that you can start to have a positive influence on your pain. As you said, you're living proof that you can do that. So yeah, thanks again for talking to me today.
No worries. Thank you.
Cheers then.